Hi, my name is Lovedip Singh, and this presentation is for the domain modeling of a clinical decision support system for the prescription and monitoring of enoxaparin. Enoxaparin is an anticoagulant drug. This means it prevents blood clots from forming and growing through slowing down the clotting process. The route of administration of enoxaparin is intravenous and is administered through injections. The class of anticoagulation medications to which enoxaparin belongs to is called low molecular weight heparin. Enoxaparin is used in the treatment of venous thromboembolism. This includes deep vein thrombosis and pulmonary embolism. It can also be used in the treatment of myocardial infarctions. Enoxaparin is often used alongside other anticoagulation medications such as warfarin. Enoxaparin is considered a high-risk medication as it prevents all blood clots. This means any accidental bleeding caused by the drug during its administration will be difficult to stop. This makes enoxaparin prone to adverse events, as incorrect or missed pre-administration tests can increase the likelihood of bleeding. Incorrect dosages may also be prescribed due to poor pre-prescription tests. In a recent Danish study, 61.2% of adverse events relating to anticoagulants resulted in fatal or serious injury to patients. The study acknowledged that prescribing an insufficient amount or an excess amount of anticoagulants were the most frequent cause of these adverse events. These prescription errors not only pose a significant threat to patients and their safety, but also affect the wider health system. For example, repeat tests, increased hospital stays as a result of adverse events, increased waiting times for other patients, add up to significant costs. This may also mean people's trust in the health system is reduced. A decision support system can help reduce these errors and improve patient safety, which can also improve the health system. This can be done through identifying high-risk patients prior to the prescription, improving the accuracy of prescription dosages, and effective monitoring post-administration of enoxaparin. One of the guidelines that will be used for this clinical decision support system is from Capital and Coast District Health Board, who have developed guidelines for therapeutic anticoagulation management. These guidelines are available on the internet. The guidelines include baseline testing of the patient, bleeding risk assessment, contraindications, indications, dosage calculations for enoxaparin, and monitoring. Here are the guidelines for the bleeding risk assessment, which should be undertaken by the clinician. The second guideline that will be used in this decision support system is from the New Zealand Formulary. This guideline documents the interactions between enoxaparin and other medications. This guideline provides information about the severity of the drug interaction. It also has information about the action required if both drugs are permitted to be used alongside each other. An explanation and the type of evidence which suggests the interaction between the drugs is also given. Here is a mind map representing the process of the prescription of enoxaparin. This decision support system uses inputs and calculations to provide outputs to improve patient safety and reduce prescription errors. Here are the inputs for the decision support system. The first input is patient data. This includes the biological sex of the patient, which can be divided into male and female. It also includes the weight in kilograms, height in centimeters, and the age of the patient in years. The next set of inputs are the pre-prescription tests. This includes identifying the patient's international normalized ratio, or the INR. The activated partial thromboplastin time of the patient is also required. Liver and blood tests are also required before enoxaparin is prescribed to patients. The next set of inputs help inform clinicians of any contraindications present and the risk of bleeding in the patient. This includes renal impairments, which requires the input of an estimated glomerular filtration rate, which affects the dosage calculations of enoxaparin. Drugs the patient is currently taking should also be inputted to show any adverse interactions. This uses the New Zealand formulary guidelines as well as the DHB guidelines that show an increased risk of bleeding with medications such as non-steroidal anti-inflammatory drugs or aspirin. Severe hypertension may also contraindicate the prescription of enoxaparin. Therefore, blood pressure measurements must also be taken. Comorbid conditions such as diabetes or heart failure can also put the patient at an increased risk of bleeding. Severe liver disease is also a contraindication for the prescription of enoxaparin. A platelet count of less than 50,000 per cubic millimeter, as well as recent procedures such as eye surgery less than 1 month ago, are also contraindications. Active bleeding and conditions with high risk of hemorrhaging are also considered as an input. This includes previous gastrointestinal hemorrhaging or blood coagulation disorder. The next set of inputs are related to the treatment. This includes the indications such as deep vein thrombosis or pulmonary embolism. It also includes the estimated duration of the treatment. After inputs, the decision support tool will calculate several variables which will help produce outputs for decision support. This includes blood pressure, dosage calculations, contraindications that may be present, drug interactions, the body mass index, and the bleeding risk of the patient. Outputs are the final part of the decision support tool. Alerts are the first output. This includes contraindications and the bleeding risk. These are calculated from the input data. These alerts can be reviewed by the clinician to aid in the prescription of enoxaparin. If no contraindications are present and the bleeding risk is low, the clinician can use the dosage calculations to prescribe enoxaparin to their patients. The guidelines suggest using an initial treatment dose of 1 mg per kilogram in all patients except for those who are on dialysis. The 12-hour and 24-hour dosages of enoxaparin are calculated based on renal function and estimated glomerular filtration rate. The final output is the monitoring recommendations for enoxaparin. The guidelines suggest monitoring peak anti-10A activity 4 hours post-administration. Monitoring is highly suggested for patients who weigh less than 50 kg, have a body mass index of greater than 35, pregnant patients, and those expecting to receive treatment for 14 days. Limitations of this decision support system include the reliance on inputs. Incorrect inputs such as the body weight of a patient can result in incorrect dosages being calculated. Information of incompetent patients may not be available, and therefore they cannot make use of this decision support system. Another limitation of the decision support system is that updates to the New Zealand formulary interactions may not be instantly available for the decision support tool. These are the references, and thanks for listening.